If you are approaching age 65, or if you are already retired, I need you to stand up, walk over to your desk, sit down, and pay close attention to me right now. Because we need to have a very serious, very honest conversation about a massive misconception that is threatening to wreck your financial security in retirement. I hear it all the time. People come up to me and say, "Susie, I worked hard for 40 years, I paid my taxes, and when I turn 65, my healthcare is going to be free because of Medicare." Are you kidding me? Medicare is not free. Let me say that again so it rings loud and clear in your ears. Medicare is absolutely not free. It is a bill that will arrive every single month for the rest of your life. And if you enter retirement blindly assuming the government is picking up your medical tab, you are setting yourself up for a catastrophic financial awakening. Let's look at the hard truth of what this actually costs you right now. First, you have Medicare Part A. This is your hospital insurance. Now, for most of you, Part A is premium-free because you or your spouse paid Medicare taxes for at least 10 years while working. But don't celebrate just yet. Because if you actually have to go into the hospital, Part A hits you with a massive deductible before it pays a single dime. You are responsible for a deductible of $1,736 for each benefit period. That is not an annual deductible, it is per benefit period. If you go into the hospital, get discharged, and have to go back in a couple of months later, you could owe that $1,736 all over again. Next is Medicare Part B. This covers your doctor visits, outpatient care, and medical equipment. You cannot escape the premium here. The standard monthly premium for Part B is $202.90. Think about that math. For a married couple, that is over $400 a month right out of the gate, which is nearly $5,000 a year just to have the basic right to see a doctor. And guess what? That premium is usually deducted right out of your Social Security check before you ever see it. On top of that monthly premium, you have an annual Part B deductible of $283. And once you meet that deductible, you still have to pay 20% of the cost for every single Medicare-approved service. 20%! And original Medicare has absolutely no out-of-pocket maximum. If you get seriously ill, that 20% can wipe out your entire retirement nest egg. Then we have Medicare Part D, which is your prescription drug coverage. You buy this through private insurance companies, so the monthly premium varies based on the plan you choose, averaging around $34.50 a month. The maximum deductible your plan can charge you is $615. Now, the good news is that the out-of-pocket maximum for covered drugs is capped at $2,100. That protects you from astronomical drug costs, but it is still another $2,100 out of your pocket. Are you adding this up? Between Part B premiums, a Part D plan, and a Medigap supplemental policy, which you absolutely must buy to cover that dangerous 20% coinsurance gap, the average retiree is easily spending $4,000 to $5,000 every single year on healthcare premiums alone. But it gets even more dangerous. There is a hidden trap waiting to snap shut on anyone who brings a decent income into retirement. It is called IRMAA, the Income-Related Monthly Adjustment Amount. If your modified adjusted gross income from 2 years ago was more than $109,000 as an individual, or more than $218,000 if you filed jointly, the government decides you are rich. And because they think you are rich, they slap a massive surcharge on your Part B and Part D premiums. Your standard $202.90 premium can instantly skyrocket to $284, $405, or even as high as $689.90 per month, per person. I recently heard from a couple who sold a rental property to simplify their retirement. That one-time capital gain pushed their income up, and 2 years later, they opened their Medicare bill to find a monthly premium surcharge that cost them an extra $10,000 for the year. They were devastated. So, what is the fear here? The fear is that healthcare inflation is eating your retirement alive. Your healthcare costs will rise faster than the Social Security cost of living adjustments. If you do not plan for this, you will be forced to downsize your lifestyle, pull extra money out of your traditional IRAs, which triggers even more taxes, and potentially push yourself into a higher IRMAA bracket. It is a vicious financial cycle. So how do you protect yourself? What is your actionable takeaway today? First, you must treat Medicare as a permanent, non-negotiable line item in your retirement budget. If you are calculating how much you need to retire, you must factor in at least $5,000 per person, per year, just for baseline healthcare costs. Second, you need to manage your income like a hawk to avoid the IRMAA brackets. Be incredibly strategic about when you take capital gains, when you withdraw from traditional tax-deferred accounts, and how you execute Roth conversions. Keep your income under those thresholds so you aren't penalized for being financially successful. Third, if you experience a life-changing event, like retiring, losing a job, or divorcing, and your income drops significantly compared to the tax return Medicare is looking at from 2 years ago, do not just sit there and accept the higher premium. You must immediately file Form SSA 44 with the Social Security Administration to request a new initial determination. You have the power to lower that premium if your financial reality has changed, but you have to be your own advocate. And finally, do not miss your initial enrollment period when you turn 65. If you miss that 7-month window and you don't have qualifying coverage from an active employer, Medicare will hit you with a lifetime late enrollment penalty. For Part B, your premium will go up 10% for every 12-month period you were eligible but didn't sign up. That penalty stays with you forever. My friends, true financial freedom is not about how much money you make, it is about how much money you keep, and how well you protect yourself from the costs you see coming. Do not let Medicare costs catch you off guard. Get educated, get strategic, and take control of your retirement future today.